Okay, and then if you do not have a digital Pano machine and you have to process it, these are some processing errors. So the top film is too light to be of diagnostic value. So this one, got exposed to either the film was bad or the film was old or, something happened there. The bottom film is fogged due to improper safe lighting. Again, it's a lighting issue, probably in the dark room. Maybe it got overexposed or something. And then the left film has static marks, so static electricity. So you can see that going all through the film. So those are all, again, if you have a traditional Pano, you're going to run it through a processor with fixer and developer, so a lot of the same things apply. If your fixer is old or your developer is old or the temperature is off, all of those same things apply if you're running a Pano through a traditional processor. Common technical errors. So now it's your turn. So I'm going to kind of give a little pause in between each one so that you can take a minute to try and guess what the error is on the film. Okay, so common mistakes. So what error is exhibited in this radiograph? So if you said ghost image of the earring, you were absolutely right. So here is the original image, and then at the opposite side of the film, higher up and blurry and larger, is the ghost image of the earring. On this panoramic radiograph, what is causing this large cone-shaped radiopacity obscuring the mandible? What is this? This would be an apron with a thyroid collar used, or an apron placed too high on the patient's neck. So obviously the lead aprons that we use in the Pano room do not have a thyroid collar. However, if you position it so that the back of it comes up higher on the neck, even if it's not, like super high into the hairline, but just high enough, depending on how straight that patient stands and everything like that, you can pick up the lead apron. So you want to have it very centered, and we'll show that more when we do our hands-on demonstration. But that's the lead apron. What is causing the radiolucent, the dark area, radiolucent area? It's obscuring the apices. It's right below the hard palate. That's the tongue, not all the way up to the roof of the mouth, exposing the palatal glossal airspace. What is causing this reverse smile line? This is very hard to see. Reverse smile line. So, if a patient's head is tipping up, what happens to their smile line? It looks like a frown. It's turning their smile upside down. So a patient's head goes up, chin goes up, the occlusal plane flattens or goes down. What is causing this exaggerated smile line seen on a panoramic film? Also, there is no separation between the maxillary and the mandibular teeth. So this is kind of almost like a vertical angulation error seen on a Pano. So what's happening? Is the chin tipping up or tipping down? The chin is tipping down, so it's giving that creepy jack-o'-lantern smile. The anterior teeth appear narrow and blurred on this panoramic film. What is causing it? They are blurry and they are small. Patient is too far forward in front of the focal trough. So they probably bit past that little bite line that they're supposed to bite. They bit past it. The anterior teeth appear widened and blurred on this panoramic film. What is the cause? Patient is too far back in the focal trough, too far back. Superimposition of ghost images of the cervical spine, that's what this is, this white area, that's the ghost image of the cervical spine, may be seen on the center of a panoramic film. What is the cause of that? So why does the spine sometimes show up in the center of the film? That is because the patient slouched in the machine, so they did not stand up nice and straight and tall with their feet kind of forward, they almost lean back a little bit, you'll see when we demo it. So they didn't stand up straight and get the spine out of the way. The patient's posterior teeth and ramus appear to be magnified on the panoramic film when the head is not centered. Which side of the patient is closest to the film? Should the patient be moved right or left? This is a little bit tricky, I think. So the patient's head is closer to the machine on the left side. They're actually closer on the side where it looks like the image is more of a normal size. It's not as enlarged. So the patient is closer on the left side. They should be moved to the right to be more centered into the machine. So their head is closer on the left side. They need to go right to center themselves into the machine, and then that would get rid of this distortion on the right side. So I guess you have to move in the direction of the in the magnification is what this is sort of telling me. If the patient's head is closer to the left side, so they need to move right to eliminate this distortion. Identify ghost images. So we see all kinds of ghost images. So look at all of this stuff here. This is the ghost image here. It's the opposite side. It's blurry. It's larger. I'm not sure what those are. It's a whole bunch of something. And then this is funny. This is the patient's eyeglasses. They're wearing their eyeglasses. So the ghost image is up in here somewhere. The artifact is already in the center of their head. So the ghost image is going to be somewhere up in there. It's just going to add a lot of white distortion. That's so funny. And that's actually, that's a child, because see, there's like their canines and they're still hanging on to some baby teeth and their premolars. So that's probably like a 12-year-old or something. Okay. Common mistakes. So the mandible continuity, so we can see here this kind of like jagged or like the patient moved. So fracture in the mandibular body, bottom patient has moved. So here we can see, we want to kind of understand the difference, I guess, of what we're looking for. Here, do you see this fracture line that goes all the way this way? There's so much distortion here. This is like very challenging to see, but it's trying to point out the difference. If you zone in your vision and just look right through here, this is a fracture in the mandible. And then down here, we just have this little wave, this little whoop. That's the patient moving. So one is an actual real like pathology or condition, and the other one is an error. So we don't really interpret these, the doctor does, but it's really, really helpful if we have a very good understanding of this kind of stuff. That's why we talk about it. But this is, I mean, the more you stare at it, you can kind of see this zigzaggy line. It's like, okay, that's a fracture. And this is just a wave from the patient moving. The other clue is there's a whole bunch of stuff happening around here. They got like some crazy ortho or something going on. So maybe they broke their jaw on purpose, or I don't know. Sometimes they have that surgery, where they break and reposition, but I don't know. That could just be from trauma.